What's going on, everyone? Happy Thursday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you're sick with anything else at this time, I hope you have a full and speedy recovery with no long-term issues. And as for COVID, hopefully no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, April 4th, 2024. If you're new to my channel, this is where we do the daily Pandemic Update on all things COVID and any other virus that could be a health threat to you. If you've been following along lately, you see we've been talking about a lot of different viruses. So things have been quite active as of lately, and today's going to be yet another active day. So if you're new, subscribe to the channel down below. If you want to see more content like this, of course. If you like this content, give it a thumbs up. If you want to help other people stay safe, share this with anyone you know. And of course, if you have a comment, leave the comments down below. All right, today we're going to take a look at some news stories. We're also going to take a look at the website today. Have not done that in a while. And then all the other stuff that we usually look at, and some weekly state data. First off, Queens of the Stone Age, you know, the rock band, Queens of the Stone Age, they had to cancel a show up in Edmonton, Canada, really at the last minute due to an illness. Now, they don't specify the illness, and as I have stated in the past, there are a lot of different reasons why that could be. One being legal purposes. They're not allowed to state what the illness is. So if it's COVID, maybe it is. We just don't know because they can't state what the reasoning is for them canceling. All right, public health alert. This is Chicago. Yet again, measles exposure at Southwest Suburban Walmart store. Yes, there is now a measles exposure in Cook County, which is Chicago area, and it's at a Walmart store. If you want to find out more about this individual story, about the time and place, I'm going to tweet this out after I'm done with the pandemic update for today. Taking a look at this. This is COVID-19 reminder for you. I've mentioned this many times before. I'm going to mention it again now. COVID-19, if you get it maybe multiple times, or if you have long-term complications, regardless, COVID can lower the life expectancy, and it actually became the second leading cause of death globally back in 2021 from a Lancet study. So yes, COVID. Try and avoid it as much as possible. And if you have not had a case of COVID yet, congratulations. You've been doing the right thing. You've been protecting yourself from getting COVID. And sometimes I do get these comments in the comments section that say, oh, well, you know, I've never had COVID. I've never taken any precautions. Have you actually tested? Maybe you haven't. You know, and then there's asymptomatic spread. You may have never known that you had COVID. There's a lot of different cases. But the point is, if you get COVID, unfortunately, it can lower life expectancy. Want to find out more stuff that COVID can do? I got a whole website. If you're new to the channel and you did not know, I have a forum type website, datareport.info. Type it in, and this is what you will get. You can see we have several different sections. We have a section just dedicated to long COVID. There's actually 41 topics in there. We have COVID in kids. We have COVID legal cases. Yes, that has become a big thing. Then we have a whole section just for COVID studies. Effect on the lung, effect on the heart, COVID's effect on the brain. I mean, there's several different sections. And then there's a whole miscellaneous section that's now up to 75 topics. And that section probably will go above 100 relatively soon. Do you want to know if someone had COVID? Well, while this is not a complete archive, I do have a whole section for that, where you can just go in and check and see who has had COVID. I mean, I started this just a little bit over a year ago. We'll say a year and a quarter at this point. So there were a lot of cases before then. You know, high profile figures. Didn't get them added in there. I hope to one day go back and add as many as humanly possible. And then there's COVID outbreak archives as well, which that has not been updated in a while because there are not that much information out there right now about outbreaks. You know, a lot of places this day and age, this is where we're at with the pandemic. Transparency, data not being brought to the public's attention. That's why some of these sections have not had an update or a post in quite some time. But hey, we're up to a lot of topics now on the site. We are now up to 1,101 topics, and my guess is at this time next year, we'll probably double that because this pandemic, it's not going away. And we do talk about other viruses as well. H5N1, bird flu, mpox, measles, tick-related illnesses. On and on it goes. It is free to sign up to become a member. All you have to do is click on right here. Register to become a member, and it is just easy to do. You agree to the terms, and then you go on. You create a username, I approve you, and congratulations, you can post on my site. Alright, moving on now. Taking a look now at air quality across the United States, and really not doing too bad today. That system that was in the east. Well, it's still in the northeast, but places where the front has cleared south of that system, air qualities are much better today. West Coast, you just have your traditional spots that often have problems. Taking a look at Philadelphia, EMS calls, 774 EMS incidents in the last 24 hours. That's the highest number that we have seen in some time. It was to be expected. It's been busy as of lately. Let's see what's going on in Montgomery County. Now, we're late with today's update. It's almost 6:30 p.m. here in the Eastern Standard Time. 12 EMS calls right now in Montgomery County, and I'm seeing some not so good calls. Diabetic emergency, fall victim, cardiac arrest, that's not good, choking, cardiac emergency, altered mental status, another cardiac emergency, fracture, head injury, fall victim, abdominal pains, vehicle accident. Let's hope it's less busy in Chester County. Okay, it is now, but earlier today, it was very busy out there. Respiratory difficulty, fall, abdominal pain, emotional disorder, fall, heart problems at this time. So, yes, there's calls to be had, but again, it is 6:30 in the evening when we would expect to see it less busy. All right, Walgreens this week, 13.7% positivity, 15.1% last week, difference of down 1.4%. Testing was also down this week. Let's just do two states today. In Arizona, the positivity rate is 16.1%. The prior week was 21.5%. That's a difference of down 5.3%. Testing is also down, 155 versus 205. Let's see. I don't think we can take a look at Ohio. Yes, we can take a look at Ohio. Remember we used to do Ohio's on Thursday? Well, we can do Ohio today from Walgreens. 10.4% positivity rate. The prior week was 10.7%. That's a difference of down 0.3%. And testing. Yes, testing is down at this time as well. So good to see that the positivity rate is dropping in those two states at this time. All right, BioBot. We have to take a look at BioBot. Take a look here. All four regions of the United States, including the Northeast, are dropping at this time. Remember we were showing you wastewater scan had a rise in the Northeast? We'll show you that next. It's changed a little bit. They've done an update. Just the other day, it was rising in the Northeast. Now take a look. They've updated it. They've corrected it, flattened. Now it dropped a little bit. Think we need to see another update to clarify just what's going on here. Notice how it just suddenly went completely flat and then dropped. Don't know what that's about because if you've been following me, a couple days ago we showed you it was starting to go upward, and now it's not. So maybe it's going to correct lower. BioBot's going lower. We can only hope, right? We'll just have to see what ends up happening. Let's do two wastewater sites around the country. Let's go into, how about we go up here to South Bend, Indiana. Let's see what's going on with that. And in South Bend, Indiana, we can see for COVID, it is dropping ever so slightly at this time. RSV is low. Influenza A did have a slight rise. Now it looks like maybe it's going to start dropping again. Influenza B, starting to rise a little bit again. And norovirus still high, but it is dropping at this time. And wow, look how high they got back in February. It went over to 300,000 pathogens. That's just insane that they had that much norovirus. They also had a detection of mpox, it looks like, back in February. And taking a look at hepatitis A, there are some recent detections of that, just as soon as most recent as April 1st at this time. All right, let's do another wastewater site. And this time, let's go down to the south. And in the south, we will take a look at New Orleans and see what's going on there. And we'll do the western wastewater site for that area, and taking a look at COVID. COVID is medium at this time, dropping though, and you could almost say it's almost down to low levels. RSV is low. Influenza A, it's rose a little bit. Influenza B is dropping. HMPV saw a significant rise at the end of March, and norovirus did see a small rise as well. And coming down here to hepatitis a few detections as of recent, and some Mpox detection as well. Apologies if my voice still sounds congested. I'm feeling fine now. The only issue that I'm having is with this congestion that just will not go away, and my voice still sounds nasal. I got a feeling we're going to be dealing with this for quite some time, and it does get worse when I do talk a lot, so sorry guys, there's nothing I can do about it. No matter what I take, no matter what I do, no matter how much liquid I drink, it just does not go away. Hopefully at some point it will. Alright, let's take a look at some CDC data. A few states are seeing some rises in deaths at this time, but it's few and far in between. Ohio is one of them. Then when we come down here to Georgia, looks like Georgia is relatively flat at this time, and the Carolinas are seeing a slight rise at this time as well. Taking a look at hospitalizations, they continue to drop at this time, 9,345 admissions in the past week. And taking a look at the drop, it's down by 13.9%. We'll get a new update for this week again tomorrow. And we'll also get an update on this as well. Epidemic status for COVID. It's not growing in any state at this time. For flu, it is growing in 2 states. Likely growing, I should say. Not growing because that's 2 different things here. It's likely growing here in South Dakota and in Oregon, and this will not update this week. It updates every other week. That is the variant proportions, JN.1, which has actually dropped a little bit, 86%, because JN 1.13 is at 10.8%, and JN 1.18 is at 1.6%. And coming over, taking a look at New Jersey, you're seeing slight rises now with hospitalizations. I think it's just more of a bouncing around, but nonetheless, it is going up ever so slightly here. You can see it bottomed back on March 25th. Yeah, March 25th was where it bottomed at 256, and now today we're at 308 over in the state of New Jersey. On a ventilator, 11. In the ICU, 44. Discharges at this time, 36, and this is with 69 out of 70 hospitals reporting at this time. New York State, bear with me here, I have to refresh this. There has been issues with trying to get some data out of New York State today. Not sure what is going on with them, but here we go. 687 new cases is what they are reporting today. And hospitalizations, I already refreshed this multiple times because I've been trying to get this all afternoon. And it looks like, you know what, we have to refresh this yet again. Looks to me as if this is not up-to-date data. Again, I don't know what their issue is here. Yeah, okay, it is saying April 3rd now. Okay, this is good. And it does look like the hospitalizations dropped ever so slightly today. 554 versus 44 people in the ICU. So that is downward, and looks like New York State maybe it's going to go back to its steady decline in hospitalizations. They continue to be much lower than they were at this time last year. All right, we have to completely switch browsers now because we have to take a look at some weekly states. Connecticut. The current week for influenza, they have 343 cases so far. This is all incomplete data. COVID-19, 124 cases, and just 9 cases of RSV so far this week. Now moving on to, let's see, we can't do California. We can do Colorado. Hopefully we can do California tomorrow. If not, you'll have to wait till Saturday to hear about California. Colorado. Some good news here. Their hospitalizations, they continue to drop. 85 people in the hospital as of April 2nd. Just 1 new hospital admission higher than last week. That takes that number to 112, so just 1 higher. Cases reported this week, 628. That is down by 140. Currently hospitalized, once again, is at 85. That is down by 10. More good news. Chicago, hospitalizations. They're dropping for COVID. 5 is the number. Total beds in use is down by 1.3%. Emergency department visits is at 0.5%. And it does say here, so I should correct myself. When it says total beds in use, 1.3%. Last week it was 1.4% being used for COVID out of all the beds that are being used in the Chicago area. Laboratory confirmed cases, 53. That is actually down. Deaths, are down as well. Vaccinations, less people have gotten vaccinated in the past week. Massachusetts, influenza severity is moderate at this time. COVID-19, emergency department visits are minimal and hospital admissions are low. 12.3% of all emergency department visits were for respiratory disease at this time, so that's not good. And I mean, that's still quite a high number, and that's why I'm saying that's not good. And as we know, when we take a look at hospital capacity, Massachusetts overall is not doing that great for hospital capacity. A lot of beds are being used in Massachusetts. Overall, for Washington State, COVID-19 emergency department visits down 22%, influenza down 30%, RSV down 50%, hospital admissions are down 31% for COVID, 29% for influenza, flat for RSV. And when we take a look at COVID-19 ICU beds, that's actually up by 3, taking that total to 16 at this time. Alrighty, folks, that's all I have for today's pandemic update. If you enjoyed this update, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs to see these updates, by all means share these with them. And of course, if you have anything to say, leave a comment down below. I will see you all again next time. For me and my horrible voice, which I hope does improve at some point, stay safe, everyone, and have a fantastic Thursday evening. Thanks for watching.